Hello everyone, this is Shri Banerjee, and today I'll be talking to you about the role of epidemiology in public health. Before we begin, welcome to this course, Intro to Epidemiology. I go by Dr. B, and I started off my training as a medical doctor, and then I got interested in epidemiology and transitioning from individual health to public health. And so I got interested in public health and received my master's in public health and then a PhD in public health, and then I received further training from Johns Hopkins Bloomberg School of Public Health. I also received a certification in public health. So my work entails doing research, teaching, and working in various nonprofit organizations. So today again, I'll be talking about epidemiology and how it applies to public health. And I also will be going over a case study in order to delineate further how epidemiology plays a role. So the key aspects of the definition of epidemiology are that there are certain determinants that are key to epidemiology. So some of the things that you want to look for are disparities that may be present. This terminology of disparities is widespread in the discipline of public health, but you will once again see this present in the context of epidemiology. Additionally, you will want to look for the distribution of any disease that you are interested in investigating. So is there a pattern that you see predominantly in stroke? As it turns out, the South is considered the stroke part of the stroke belt. So there is a higher preponderance of stroke in the South rather than the North. Similarly, multiple sclerosis, any disease you can think of, cancer epidemiology, you want to be thinking in these terms. Population, again, are there specific populations that the disease is affecting? Again, also morbidity and mortality, all of these topics which we will be going into in much greater detail in the next 7 weeks. So again, epidemiology is concerned with the distribution and determinants of health and diseases, morbidity, injuries, disability, and mortality in populations. Epidemiologic studies are applied to the control of health problems in populations. So here's a case study, and this is going back to Flint, Michigan. You might have encountered this in various studies since this is a very recent current event. So what was happening in Flint, Michigan was that the water source was switched from Lake Huron to the Flint River in April 2014. All of a sudden, residents started noticing rashes and also altered color and odor in the water. Initially, physicians thought that the rashes were just due to eczema. So this is, on the left, a picture of 4-year-old Gavin Walter. That was the first patient, or what we would call patient 0, that the doctors noticed having some sort of rash. This is how it looked. And this is the type of water that was coming out of the residents' tap. So now let's jump to a little bit of history. In order to understand a discipline, you have to understand where it's coming from. So this is looking at John Snow, the father of modern epidemiology. Now, many of you might know John Snow as the hero of Great Game of Thrones, but the original John Snow is actually part of the physician that figured out the source of the cholera epidemic. So the cholera epidemic seemed to be originating from contaminated water supplies. So what he did is he took this map and he used spots to delineate cases. And also he used the 11 pumps that were all around the city. So what I did as an exercise, I used geospatial epidemiology. I used GIS to retrace his steps, and I created all the cases through software, and also I created all the areas that the pumps were located. So if you get a chance, take a more in-depth look at the map that I created in the announcements, and take a look at what was going on in this case study. There's a lot of information available, even outside of what has been provided for you within the scope of this course. So John Snow created a natural experiment. Two different water companies supplied water from the Thames River to houses in the same area. There was the Lambeth Company, which moved its source of water to a less polluted portion of the river. And so Snow noted that during the next cholera outbreak, those served by the Lambeth Company had fewer cases of cholera. So he came to some conclusions based upon this. So now let's jump to some more recent, well, fairly recent, about 60 to 70 years now. The Framingham Heart Study is one of the classic studies which investigated coronary heart disease risk factors. And this was one of the first studies. What was interesting is that this was one of the first studies where the association between high blood pressure and cardiovascular disease was delineated. Personally, I did a lot of research with the original cohort and the follow-up cohorts, actually, and just as a matter of exercise and as a matter of research. There's also smoking and lung cancer studies, which were applications of epidemiology, AIDS, chemical spills, breast cancer screening, secondhand cigarette smoke, even association between HPV and cervical cancer. It took a long time before epidemiologists and researchers found out that there was actually an association between viruses and cancer. So here, I'm not going to read each one of these applications, but as you can see, there are many different applications, including the up-and-coming molecular and genetic epidemiology. There are so many applications there. Also psychological and social epidemiology. There's a lot of new programs that are being started in these fields. So I encourage you to take a look into these. So examples of trends that have been taking place recently are chronic diseases replacing acute infectious diseases as the major cause of mortality and morbidity. So in 2009, the leading cause of U.S. deaths were heart disease, cancer, and chronic lower respiratory disease. There were also increases with not only Alzheimer's disease, but kidney disease and hypertension. So taking a look at this mortality pie chart, basically infectious diseases were at the top of mortality in 1900. And cancer and cerebrovascular diseases were much lower. But then when you fast forward to 2009, the biggest causes of disease are heart disease and cancer. So finally, we're going to end this talk with looking at Flint, Michigan, and what was going on. So not only was there concerns with rashes, there were also all these other types of symptoms that were coming up. So with lead poisoning, you are bound to see, which ended up being the case in Flint, Michigan, you're bound to see neurotoxins, lower IQs, behavioral problems, learning disability, decreased ability to pay attention, and even increased antisocial disorder. So this was definitely a serious issue. Now, I wanted to make a note that the color that you see is not coming from the actual lead. It's actually coming from other chemicals that are within the water. But because those other chemicals were present, the lead actually was a simultaneous discovery, which followed into one of the large epidemiological investigations as to what was going on. And a lot of the city's water sources in other cities with old pipes. So as you go through your epidemiological studies, you'll see there are many interesting scenarios to study. I encourage you to go off on your own and explore your own area of interest. And please contact me if you have any questions. I look forward to interacting with each and every one of you. Thank you.